Colleagues, we then move on to our next item, and I now have the pleasure of welcoming Mr. Koen Van Troos from CELEP for an exchange of views on the consequences of the COVID-19 pandemic on pastoralists and mobile livestock keepers in Africa. The Coalition of European Lobbyists for Eastern African Pastoralism, CELEP, is an informal coalition of European members and East African partners focusing on communication, knowledge management, and lobbying in favor of pastoralism in Eastern Africa. Many pastoralists and mobile livestock keepers in East Africa are in need of support as a result of COVID-19. They are also hit by the locust infestation. Pastoralism is based on mobility to access production, resources, and markets in order to ensure livelihoods. The context of the COVID-19 pandemic demonstrates the need to provide guidance to all partners and stakeholders, including governments and players along the livestock value chain. It underlines that pastoralism is part of an ecologically adapted local food production and therefore a sustainable food system. And that is important. That is why it's important that pastoralists are supported in ensuring safe access to local markets during the pandemic. We have very limited time, of course, always, also for this exchange of views. So I will then give the floor immediately to Mr. Van Troos for 10 minutes, please.
Thank you very much, Mr. Chair, for giving me the floor. And thank you also for the other speakers who have already highlighted the importance of One Health. So let me start briefly by presenting myself. So my name is Koen Van Troos and I work for an NGO called Vétérinaires Sans Frontières Belgium. And today I want to give some insights on the importance of pastoralism as an example of local sustainable food systems, and also give you some ideas on why a One Health approach should be developed to cope with the outbreak of the current pandemic and prevent future ones. We are also part of CELEP as a focal point, as was mentioned in the introduction, and CELEP is a coalition that advocates for the recognition of the rights of pastoralists. Now, who are pastoralists actually? Well, pastoralists are livestock keepers who use a variability of nature to produce food and to earn a livelihood. And their production system depends mainly on being mobile and moving around with their herds. Thanks to their mobility, they can access water and pasture to feed their cows and produce milk and meat in an environmentally friendly way. Mobility also allows them to respect the carrying capacity of the rangelands, which cover between 40 to 45% of the African land surface. Thanks to mobility, grasslands have time to recover after grazing. This increases their capacity to absorb carbon, which is important to fight climate change. Pastoralism is practiced on all continents, not just in Africa, but also in Europe. The number of pastoralists in the Sahel and in the Horn of Africa, for instance, was recently estimated at 58 million people, which is about 11% of the total population. Now, in addition to demographics, pastoralism also contributes significantly to African economies. In Kenya, the pastoralist sector has an overall estimated value of 750 million euros, whilst in Uganda, the livestock sector contributes 7.5% to the GDP, and in Somalia, livestock represents around 75% of the country's exports. African pastoralists also contribute significantly to increased food security and nutrition. Animal products are excellent sources of nutrients, and regular consumption of livestock products has a positive impact on the reduction of malnutrition, in particular in rural areas. It is important to mention milk in this regard. Milk is a primary resource of protein and has an excellent nutritional quality. It is also important to mention that in many pastoralist communities, dairying is an activity usually practiced by women. This is an important asset of pastoralist communities to fight hunger and food insecurity in a world where 60% of the hungry people are women. Selling milk allows them to have a livelihood and buy nutritious foods. Now, though the importance of pastoralism in Africa seems obvious, this is not fully recognized by policymakers. African pastoralists therefore continue to bear the consequences of decades of socio-political marginalization. Lacking investments in infrastructure and basic services such as education, healthcare, and etc., has led to higher illiteracy levels, higher poverty rates, and poorer health services compared to national averages. Furthermore, pastoralists increasingly have to compete with other types of land use. Accessing their traditional grazing grounds and water points has become difficult. This includes, for instance, mining and large-scale agriculture. In West Africa, pastoralists have to deal with increasing security and recently have had to deal with floods destroying their pasture. In Eastern Africa, as was said in the introduction, the desert locust outbreak has had a very negative impact on pastoralists. And it is within this context that African pastoralists now have to deal with the COVID-19 crisis, which is in many cases a crisis on top of a crisis. In terms of African pastoralists becoming sick or in the worst case die because of the virus, this impact seems rather limited, as can also be seen elsewhere in Africa. And though there might be some underreporting of the number of COVID-infected people in the continent, African figures remain relatively low. Nevertheless, this does not mean that the direct impact of COVID-19 should be neglected. Pastoralists in particular should be considered in strategies trying to contain the spreading of the virus. Although they mostly live in areas with low population density, their mobility can in fact enhance the spreading of the disease through contacts between infected and non-infected people. It is therefore important to discuss the impact of COVID-19 on pastoralists' livelihoods, as without livelihoods, it is impossible to pay for healthcare, nutritious foods, and other things. We see that the control measures trying to prevent the spreading of the disease are having a devastating impact on African pastoralists. Herd mobility, which is at the core of pastoralist livelihoods, is now very much disturbed, which is an enormous problem, of course, for pastoralists, because when they are confined to certain areas, their ability to access water and grazing points is reduced, which means their entire production strategy is threatened. Reduced production has a long-lasting negative impact, in particular on the nutritional status of poorer people, vulnerable women, people with disabilities, and the elderly. Reduced mobility also means that people and herds stay longer in one place altogether, meaning that risks of contamination will rise. In addition, patterns of land use and land ownership are disturbed, which increases the likelihood of conflict outbreaks between pastoralists and other land users. The inability for pastoralists to move has also had a devastating impact on their ability to access markets. In Eastern Africa, 90% of the consumed meat comes from pastoral systems. Trading animals and animal products and buying other foodstuffs has become increasingly difficult due to COVID-19, and consumers now have reduced access to meat and milk, and pastoralists are no longer able to sell their animals or their produce on local, regional, or international markets. In addition to limited access to markets, pastoralists also find it more difficult to access services, in particular animal health services, leading to serious consequences for their livelihoods. Now, what can be done? Well, there are some short-term things that can be done, and then also in the longer run. In the short run, a first immediate need seems obvious, and is to make sure that the measures to slow down the spreading of the virus are adapted to local contexts. In order to do so, communities need to be consulted to have a better understanding of what they deem possible to protect their health, while safeguarding their livelihoods and food security. This was also mentioned before. In pastoral areas in Eastern Africa, this means discussing with traditional leaders, community elders, women's groups, youth groups, village administrators, and etc. In addition, awareness-raising efforts on hygiene, social distancing, etc. will only work if the communities understand them and are convinced of their usefulness. To play their role in COVID-19 management, pastoralist communities need to be fully informed about the disease. This also means that relevant information should be made available to pastoralists in their own languages. Second, government response to COVID-19 in pastoral areas in Africa should allow pastoralist mobility. Transboundary mobility of pastoralists has become increasingly difficult due to the pandemic. Whilst work should be done in the longer run to guarantee mobility, short-term solutions should equally be developed to work with local authorities, local communities, and local private sector actors to make sure pastoralists have access to cash transfers and food aid, as well as markets and trade. Cash transfers and food aid should be considered in particular for vulnerable people, such as female and child-headed households. In addition, food aid should include feed aid for their livestock, and emergency aid could also focus on providing access to animal health services. Regarding access to markets and trades, programs should focus increasingly on mobile technology to continue trade without physical markets and for monetary transactions. Kenya, for instance, is one of the world's market leaders in mobile money applications such as M-Pesa, which is also used by pastoralists. This is a clear asset also for providing cash aid. Third, it would be very important to reinforce African health systems according to a One Health approach. This was also mentioned by DEFCO and by Mrs. Bantele before. One Health is a concept which states that there is an important linkage between human and animal health and the environment, and that interventions should integrate these three components in a holistic and multidisciplinary approach. The importance of One Health becomes apparent when discussing zoonotic diseases, which are diseases such as COVID-19 that originate in animals. A One Health approach applies very much to pastoralists as well, who depend on their environment to provide pasture and water to feed their animals. The animals should be healthy to make sure that they can be sold at a good price and milk and meat can be consumed so that pastoralist communities will be in good health themselves. Applying a One Health approach is therefore not limited to health interventions, but is rather a framework for all interventions developed under the Sustainable Development Goals agenda. This can be done by projects addressing both pastoralist lives and livelihoods, for instance, through combined human-animal health interventions. A One Health approach should also be applied to epidemiological surveillance in pastoralist societies to avoid future outbreaks of zoonotic diseases. In the long run, more support should go to pastoralists in Africa through enabling policies at the national, regional, and international level, assuring mobility of people and their herds, as this is vital to the pastoralist production system. The EU can play a role through its development and humanitarian policies and also through its trade policies in making sure they abide to the principles of policy coherence for development. Though trade is important, trade should complement, not replace local food production, and trade policies should be coherent with development and humanitarian objectives. Current crisis should therefore be regarded as an opportunity to put local food systems, such as pastoralism, at the forefront. These food systems benefit local food producers, improve food security, and have a positive impact on food safety and climate change. Because let us not forget that climate change is the other ongoing crisis, and promoting local food systems such as pastoralism is expected to have a positive impact on climate change mitigation. Now, I hope that these considerations will be useful also for the drafting of the report and for other discussions ongoing in the European Parliament. And I would like to take the opportunity also to call on the European Parliament and the European institutions to explicitly support and recognize the importance of pastoralism and its development and humanitarian policies. Thank you very much for listening, and I will be happy to answer your questions if you have any.
Thank you, Mr. Van Troos. I will now leave the floor to the members, one member per political group, and we will start with Hildegard Bentele from EPP.
Yeah, thank you very much for this presentation. And I have to admit, I was not aware of the importance of the pastoralism sector, and this is what I learned from Mr. Noyes or from you now. Since I was dealing with resilience, my question to you would be, you mentioned it a little bit, infrastructure, education. So how can we, because it to me sounded, the environment of pastoralists sounded a little bit fragile. If we consider climate change, if we consider ethnic conflict, if we consider, well, other interferences like also natural catastrophes or locusts, you mentioned it. So as good as the concept sounds, the question, how can we store food? How can we let's say to make it more resilient and maybe also to adapt to the circumstances which might have changed. As I said, if you are if it's not possible to be mobile, are there any other concepts for pastoralists, or do they have to do they have to earn their existence by the traditional methods? You mentioned mobile money. This looked to me like an invention, but if we look on a, let's say, on a longer perspective, so how could we, how could the concept of pastoralism be made in general more resilient, since we have to face this kind of challenges? They will be more often, and they will maybe disturb the livelihood and environment of pastoralists more often than we think. Also, urbanization, I think, might be might have an influence. So, my question to you is: I understand that you stick to the traditional concept, but nevertheless, what concretely do you see as measures to make it more resilient and to adapt it to new challenges?
Thank you. Norbert Neusser, SND.
Ja, vielen Dank.
Thank you very much. Thank you very much, Koen, for your excellent presentation.
I think pastoralism is an area which has been totally underestimated by us. I was made aware of this problem by a report which we had in cooperation with the ACP countries some years ago. If we talk about food security, pastoralism is a very important point in countries of East Africa, in the Horn of Africa in particular. Food production is a key element of the resilience of the populations. As Koen said, that's a good reason to have a greater focus on pastoralism in development aid and cooperation. I'd like to home in on food aid and feed aid. A lot is needed to support people, but animals need it too, so that and so people will hunger if the animals can't get to the next pasture. We must do all we can to enable pastoralism. Perhaps a few examples could be illustrated. Another point, I think, which is important in this connection in the pandemic is the One Health approach. Just like AIDS or Ebola, Corona is a zoonosis, an infection which has come from the animal world, has been transferred to people. I think it's important that this approach, which brings together people, animals, and the entire environment, we need to home in on that more. Perhaps there are some good examples here which could be presented to us.
Thank you. Charles Goerens, Renew.
Please, can you press the speak button?
Mr. Goerens, your microphone is open. Can you just press on the speak button just once? Thank you.
Ça va maintenant? Ça va?
Yes.
Ça va, non?
Oui, on vous entend.
Oui, très bien. Alors, j'avais commencé par dire que priorité doit donner au sauvetage de cette activité.
I think we should give the priority. Mr. Troos has just explained, given that pastoralism is synonymous of mobility, any blockage can have a damaging effect on herds which stand still. That leaves an effect on the land and its effect risking desertification. I'd like to talk about the immediate measures which we can provide to the problem. There's a problem of the economy and a structural problem. In terms of the economy, that's this COVID-19, which is a source of a lot of problems and blockages with the harmful effects we know. If there's a lack of food, the threat of desertification of some land, what can the EU do? We are political actors representing the European peoples. What do you expect of us? What are the immediate actions that we have to provide through the Commission so that these dangers can be addressed? That's my first question. The second question is about resilience. This also has a short-term and a long-term effect, and direct and related causes. The people living from pastoralism don't have the necessary needs. Access to credit is very difficult given if you invest the same amount in industry, you have a return of 200, not a return of 50. That's why they have a chronic lack of capital to develop. The other aspects were raised by Mr. Neuser and Mrs. Bentele. Give up an answer to these two questions. What do you expect from the EU to improve the resilience of pastoralism in the long term? Thank you.
Thank you. And I give the floor to Caroline Rose from the Greens.
Merci, Monsieur le Président.
Thank you, Madam Chairman, and thank you, Mr. Koen Van Troos, for that presentation. I agree with what you said, Chairman. We've got to preserve pastoralism in Africa from the economic, social, or environmental standpoint. This is one of the practices which provides ecosystemic services and allows for food security of the region. We must set up public health measures adapted to the pastoral community to protect their health, as well as to guarantee the necessary migration and to their subsistence capacity. The EU could play an important role by financing these types of measures. For example, for health workers within the pastoral committee, which have an interface with the regional and national health authorities in prevention and the detection of cases of disease. In addition to financial measures, we need structural measures to make sure that these communities will remain facing multiple crises like health crisis or climate crisis. We also know the major effects that climate change will have in certain areas. We've got to try to make sure that these pastures are security, so that they, by recognizing the collective right to their ancestral lands. Now, the free trade agreements impact export with respect to the CAP, which destabilize the African market. For example, you see the massive imports of cheap goods into the western part of Africa, and it's a very difficult thing for these communities. As veterinarian, what measures should be set up to reinforce the detection of zoonosis in farms and pastures in Africa? And you said that One Health is very important, but what place will there be for zoonosis in this One Health approach? Thank you.
Thank you, and I give the floor to Beata Kempa, ECR. Not connected, and I don't think we have anyone connected from ID and GU as well. No? Okay, well, thank you. That was then all the questions from the members. I will now also give the opportunity to give the floor to the Commission. Do we have Hans-Achim Krebs connected? Oh, please, Commission.
Yes, hello, je suis Hans Krebs.
I'm Hans Krebs from DG-DevCo, and thank you. I'm very pleased to say that in December, we will be dealing with this issue on the surveillance that we can make for animal diseases, which for animals on the pastures. We're going to sign an agreement with the FAO for the struggle against ruminant plagues. The idea is to enhance veterinary services, and at the national level in the various African countries and other countries where pastoralism is important, we will be mobilizing funds to try to have a campaign for epidemiological surveillance and vaccinations. It's a global world plan to eradicate that disease by 2030. Now, we've got another plan, which is a project, a very One Health type project. At the beginning, it was an Ebola project, which was mainly focused on wild fauna for the Ebola virus, taking on board the environment to find out how bats move around in this very wild area. And there's a new phase where we're going to add a new activity with a writer, research on the coronavirus. We all know that in this fauna, wild fauna, there is a coronavirus which is accumulating. We want to find out how it circulated and how this presence in wild fauna could affect humans, and to find out how much of the genome is subject to mutations, which is a very interesting issue in order to avoid other waves or any pandemics. We help us knowing the virus. Now, as for revenue for pastoralists, of course, one main issue is milk. In DEVCO, we have been supporting the campaign in Eastern Africa with Oxfam called Our Milk is Local. This is in Eastern Africa. What we do is prepare along with them to help them, as of next year, to have the EU delegation submit a program so that we could see how we can help the local milk producers and people who want to collect and process local milk to increase the local milk production in those countries. So we will be launching this program in January, February next year. There's another activity we've planned with Oxfam to see what other measures we could take to favor milk production locally. Now, of course, there's a major problem in those countries that the farmers are in very remote areas of the country, and governmental decisions are, of course, taken in the capitals far from these farmers. So it's difficult to do the lobbying work with the national governments. Now, another point that I heard about that Mrs. Helsberger mentioned, she said, and I have a question about that, powdered milk imported into Africa contributes to the malnutrition of the population in Africa. Now, even if we do our utmost to increase the local milk production, it only covers 5 to 10% of milk consumption in those countries. We'd like you to know that. And this is very important in the capitals. So there's a great deal of milk consumption in the capitals. So these are some of the points we'd like to raise from DEVCO. Thank you.
Thank you. And I will now give the floor back to Mr. Van Troos for replies and also to make concluding remarks. Please.
Thank you. Thank you very much for giving me back the word. Thank you also for the many interesting questions. Thank you also to Mr. Krebs for the intervention of the Commission. I think one question that was asked by both Mrs. Bentley and Mr. Goerens was about how to make pastoralists more resilient. And I don't want to go into detail about, targeted investments in infrastructure and health services that are adapted to pastoralists and all those kind of things. I think overall what is needed is a formal recognition of the rights of pastoralists. Pastoralists are still being marginalized in many parts of the countries where they live. and they don't have any recognition of their rights, of their social rights, but also of their land tenure rights, which was also recognized by one of the MEPs that intervened. Land rights, pastoral land, is often considered no man's land. And is basically being allocated for other purposes. So for large-scale investment, for agricultural investments, for mining, and etc. There are many cases actually, both in Western Africa and Eastern Africa, and perhaps also in other African territories where there are also pastoralists. So this recognition of their rights, and in particular of their land rights, is very important. And there is actually an entire movement right now that is working to have an international year for rangelands and pastoralism by 2026, which would be an important step forward also for the recognition of the rights of pastoralists. So it would be very important also for the EU to take part in that. Besides that, there are also policy frameworks that exist, both at the regional and the continental level. So at ECOWAS level, there's an international certificate of transhumance, and also at IGAD level, there's a transhumance protocol that was recently developed. The EU, through its different diplomatic and humanitarian and development efforts, can put more emphasis on the need to have these regional frameworks implemented to facilitate pastoralist mobility in particular. Then there were two other questions. So one was also from Mr. Neuser on feed aid, and to give some more information on that. Basically, the idea is that pastoralists, they have their cattle. Their cattle is basically their capital. So in humanitarian interventions, it's not sufficient to just focus on humans and improving their food security, but investment should also be done to improve the health and the health of their cattle, which can be done by providing fodder for the animals, but also by providing animal health services for the cattle, which is very important, especially, for instance, in refugee camps. And many refugees, especially in Western Africa and the Sahel, are actually pastoralists who have fled with their cows. I think there are about, in a country like Burkina Faso, there are about 2 million refugees right now, or in IDPs, I'm sorry, who have fled also with their cattle in many cases. By providing these services to them, it will help them actually to have a better future afterwards when things stabilize again. And there was also a question about the One Health approach, to ask a bit how it works and how it is put into place. I think a very important way of making One Health operational is actually by having combined human and animal health interventions, where you have these community animal health workers, because there are not enough veterinarians in Africa, but you have community animal health workers, which are basically farmers that have received a training to conduct several veterinary practices, where they will work together with community health workers who do the same thing, but with animals, and who do combined vaccination campaigns, for instance, where they vaccinate against particular diseases, especially in pastoralist settings. So basically you have then pastoralist lives and livelihoods are protected at the same time. Then there was also a question about how to increase pastoralist resilience and what should be done in the short term. I think I already gave some examples in my overview, in my presentation, of what should be done in the short run, in terms of providing assistance for fodder, assistance for animal health. These are definitely things that would help in the short run, but in the longer run, there's a need to work on mobility and to facilitate mobility. And again, and I insist on this. The need for transboundary mobility of pastoralists. And then finally, and then I conclude, I think in terms of One Health, what is very important in making it operational, especially in an African context, well, many countries have actually developed One Health plans or One Health policy frameworks, and these can be put into place. And they're mostly focused on multidisciplinary approaches. So trying to have animal health services, governmental services, working together with human health services and with environmental services to also better plan and foresee when certain things need to be done. And it's all about communication and in a multidisciplinary approach, and to make it as holistic as possible. I think that more or less concludes my intervention. Thank you.
Thank you, Mr. Van Troos, and thank you also for the members who participated in the discussion. I think it was interesting and also will add to the work that we are currently doing in the committee. Then we come to item number 10, that is any other business. Does anyone have any other business to raise? I don't think so. We come to item number 11, that is next meeting. We are planning to have a meeting on the 7th of December. We will have a vote. Also, we had one main topic about the post-Cotonou negotiations. As you know, they are coming to an end. And we are, of course, very interesting to get a report from our chief negotiator, who is Commissioner Urpilainen. I'm not sure that we will actually be able to have her on the 7th of December, but the Secretariat will reach out to you. We are trying and we are working close on that as well, as you know. Also politically speaking, with the demands from the European Parliament to give our consent to the post-Cotonou agreement. We also have a meeting planned on the 14th of December between 7 and 8:30. That will be a joint exchange with AFET and the Sakharov-Loretz. By that, I think we're coming to close this meeting. We're actually closing a bit early. I think the translators can see that as our apology, that we sometimes are a bit late and you stay with us. So that's a present from us to you, and by that we end this meeting.